Hi everyone, welcome again to Canadian Board of Aesthetic Medicine. My name is Dr. Reza Akef. I'm the chairman of the Canadian Board of Aesthetic Medicine, and I have a background as an emergency physician. I'm still practicing part-time in emergency medicine as well. And due to the spread and also the pandemic situation of the COVID-19, I thought that should be important to give some information about this virus, the transmission route, and also some of the changes that you can do in your aesthetic clinic to prevent and also to decrease the amount of the risk of the transmission for the safety of yourself and also the safety of your clients. On the first slide, we are going to very quickly review the biology of this virus. We know that COVID-19, it's an RNA virus. It's belonged to the family of the coronaviruses. Coronaviruses are usually the most common viruses that makes the common cold and also in influenza-like symptoms. We had this somehow similar epidemic situation with the SARS and MERS. Both of these two are belonging to the same family of the viruses. And it seems that the COVID-19 is most closely related to the SARS. But the problem with the COVID-19 is because of highly potentially they can mutate and mutations. That makes this situation more complicated than SARS. So about the transmission routes, we have three types of transmissions. The first one is the large droplet transmission. Basically, due to the coughing, sneezing, large droplets can spread to the environment. And this is usually very typical for most of the upper respiratory viruses, such as influenza. And that's why we're usually using a standard surgical mask for it. We have the airborne transmission, which it can be in very small particles in the small droplets of the air, and it can even transmit it by talking and speaking, and with the very small droplets can be transmitted. And this is usually, we see it with the highly contagious disorders like measles, and we have to use the N95 mask for that. And then we have the contact transmission, which is very important about the COVID-19, which basically is going to be transmitted to the touching or surfaces by your hand and then transmit to your mouth or to one of the mucosa layers. So this slide shows how it can be transmitted as a large droplet transmission, which is very important about COVID-19. You can see Ebola was about 3 feet. COVID-19 is about 6 feet. So it means that if somebody cough or sneeze, and then large droplet can be transmitted about 6 feet. And therefore, at this moment, the guideline is to have a kind of social distance about 6 feet. Airborne transmission still is a lot of controversies. So at this moment, in most of the guidelines from the College of Physicians of Canada, and also from most of the guidelines that I got from the different hospitals, it seems that it's still COVID-19. It's more a large droplet transmission, and airborne transmission is just when we are doing a high-risk procedures, like for example, when we are doing intubation procedure for the patients with hypoxia. So we have to use the kind of precaution for the airborne transmission, using definitely N95 and other precautions for the airborne transmission. But we don't need to use it as a routine, as a public. Not people should use N95. Contact transmission, again, this is a very important part of the transmission. So basically what happens, someone is coughing, sneezing, all the large droplets that has virus inside is going to settle on the surfaces, and it can stay on the surfaces alive for hours or sometimes days. It depends on the type of the surface. And then someone else is going to touch that area, the virus is going to be on your hand, and then when you touch your face, it can go to your mouth, it can go to your eyes, in the nasal mucosa, any part of the face that has mucosa layers. There is a chance that the virus can be transmitted by the touching of your hand. Therefore, washing hand, cleaning, hygiene, and not touching the face is a very important tool to prevent from this disease. So this is how we can block the transmission. Again, we have to clean the environment surfaces as much as you can. So using a 70% ethanol, every client come to the room goes, you have to clean with a 70% ethanol all the surfaces that has been touched by the body of the patients. And I would suggest cleaning the whole area of all the surface that you can. Hand hygiene is definitely very important. More and more washing your hands and using sanitizers, but just also be careful that you are not making your skin very dry and you're not going to damage the skin. but definitely hand hygiene is very, very important, and definitely avoidance from touching your face. That's very difficult. I understand that is so difficult because many people unconsciously they touch their face. Therefore, using a surgical mask is not necessary really for the transmission, as long as you have your social distance. But it's very important because it's going to prevent from touching your face. So when is usually the most dangerous time? So one of the dangerous time is the asymptomatic transmissions. And many people, they might be carriers and they don't have any symptoms, or they have very minimal symptoms and they are very strong carriers and they can transmit disease to other people. And also in the first 8 days that after the symptoms start is usually highly contagious, but we don't have any guidelines when we can, if somebody is a COVID-19 positive, when they can basically terminate the self-isolation. But some of the guidelines say if they have 2 negative PCR, then they can basically discontinue the self-isolation. But we have to also know that the PCR sometimes can be positive for weeks after this virus as well. So the symptoms of the COVID-19 is almost similar to other influenza-like disorders. We have fever, which is not always in all cases, cough and upper respiratory symptoms like runny nose, sneezing, body ache, myalgia is very, very common, and definitely is very similar to the other influenza-like illnesses. So so symptoms by itself cannot be really diagnostic, but can be helpful. In the severe cases, we might have a significant shortness of breath, or again, in the very severe severe cases, we might have central neurologic symptoms. It's the last guideline that I got from our hospital is about the ratio at this moment is about 5 to 15% of the cases they develop basically severe symptoms, and they might get a shortness of breath, and they might need a hospitalization due to hypoxia and needs oxygen, or in the more severe cases, they might need also intubation. So do we have to test everybody? Definitely not. So the current guideline, it says that we are just testing people that they have some risk factors, or the chance of having COVID-19 is higher than other people. And this is the guideline that I got it again from the College of Physicians in Ontario and British Columbia, and also the guideline from the hospital that I'm practicing. So any patients that has a traveling history in the last 14 days, all pregnant ladies, patients with a significant comorbidities like a chronic COPD, CHF, or chronic renal failure, or this type of significant comorbidities, all patients at age above 60, healthcare professionals that they want to go back and return to their duties, and they have to be sure that they don't have COVID-19, and people who had a close contact with someone had a COVID positive test. Again, these patients will be tested if they have mild upper respiratory symptoms. And again, case by case, we might decide to do the test or not. There's also a self-test assessment tool on the Ontario Health website that you can also, if you want to see if you need to be tested or not, you can use it as well. So going back to our aesthetic clinic, we all know that aesthetic clinics and aesthetic procedures are basically elective procedures. We don't have really an emergency and urgent procedures. So I would suggest you, at least on this, until we get to the peak, and then hopefully we can have flattening of the curve of this disease, it's better to minimize the number of the aesthetic procedures. But I totally understand that many clinics they don't want to close the clinic, but at least they can follow some of the protocols to minimize the risk of transmission of the disease. So I would suggest you to, for all the patients, send an email or call them and ask them if they have any of these symptoms, reschedule their appointment. If they have any upper respiratory symptoms, if they have any traveling history in the last 14 days, if they have any close contact with someone who was COVID positive now, if they have done the test and are just waiting for the result, I would suggest all patients at age 60 or above, or if they have significant comorbidities, let's reschedule them and wait. Because again, the procedures we are doing in aesthetic clinic, it's not an emergency, it's not an urgent procedure. So it's better to wait now. So I also suggest you to minimize the number of people in the clinic. So if you have a small clinic that you have just 1 or 2 treatment room, so I would suggest just a treatment provider and a client in the room. So just having one receptionist, and make your appointment in a way that just 1 or 2% in the waiting area. I would suggest you, in my clinic, I'm going just to have 1 person in the waiting area and not more than 1 person. Again, to minimize the number of the clients in the clinic, I would suggest you to arrange your booking so at least 1 hour or increasing their booking time, and also basically make a good gap between the booking, so that in this way the number of the clients that's going to be in the clinic is going to be minimized. How we block the transmission? Definitely, again, cleaning the surface areas several times. Every time the patient leave the room, all the surfaces should be cleaned with a 70% alcohol. Using surgical mask all the time. Even our receptionists and all people who are working in the clinic should have surgical masks, so decrease the risk of transmission. But more important than this, there is a risk that decrease the risk of touching your face with your hand and blocking the contact transmission route. So washing and your hands several times. Every time you enter to the room, washing your hands, leaving the room, washing your hands, and using sanitizer inside of the room several times when you are doing the procedure. And again, when the patient enters to the clinic, asking the patient, wash the hand, using sanitizer, using a surgical mask. And again, please, no more two people in the waiting area. Avoiding to touch your face as much as you can. Again, I hope that this slides and this video is going to be helpful for you. Keep safe, and again, because this disease, we still have our knowledge and information, it's limited. If there's any change in the guidelines, we're going to update you with the further videos. Thank you.